Hi, my name is Dr. Alif Musaji, the Smiling Dentist, and today we're going to talk about dental decay. Contrary to popular belief, people think that dentistry is all about treatment of disease. Actually, in the modern world, modern dentistry is about trying to enhance patients' mouths, making smiles look better, straighter, whiter, and also providing solutions for patients who have lost teeth. But we can only do that fun, sexy dentistry if we have a patient whose mouth is healthy. And that's the reason why I want to talk a little bit about dental disease. So we're going to talk in three parts about dental disease, and today we're going to focus on dental caries or dental decay, as the general public would know about it. So decay is a disease that affects the tooth structure. How does it work? Well, tooth is a very hard substance. Enamel, which is the outer surface of the tooth, is actually the hardest surface in the body. And the reason it's hard is because it's mineralized. There's a mineral that's tightly bound within the structure, and it's that gives it the hardness. But within the mouth, there is a balance, an equilibrium, whereby some of the mineral is taken away from the tooth, but then mineral is put back again. So we call this demineralization, which is where the mineral's coming away, and then remineralization. Now, if the balance is in check, the teeth remain healthy. But if the balance skews one way, so for example, if the demineralization is quicker than the remineralization, then the net effect is that the mineral from the tooth is removed. And that will make the tooth structure much weaker, and it will actually start to rot, it'll decay. And this is what dental decay is. And once that process starts, it spreads and it keeps getting worse, and so treatment is needed. So the key thing that we can do as dental professionals, obviously, is to treat decay when it's there, but ideally we'd want to try and prevent it before it even starts, before it even happens. And that's why it's key to try and help us to coach you so that we can make sure that that balance, that equilibrium is right. Let's talk a little bit about this equilibrium and what factors affect it. Essentially, if we have a mouth where we have an acidic environment, then the acid will fuel this demineralization process. And this acid classically will come from bacteria. And we all have these bacteria in the mouth. But if we feed those bacteria with sugar, then the bacteria turn the sugar into acid, and this is where this dissolution or this demineralization starts to happen. So it's key that we control sugar. But it's really important also to understand that there's more to it than just sugar. There's different factors at play. And so I want to give you the truth. I want to give you the real story behind this. So let's talk a little bit about the factors that really are important in whether a patient will be more susceptible to getting decay or less. Now, although as a profession we do talk most about sugar, and there's a reason for that. In fact, the thing that I think is most important is whether the tooth has lots of mineral in it or less. And this will be down to genetics. Some people are tall, some people are short, some people are fatter and thinner. And what we have noticed is that intuitively as dentists, we know that there are some teeth that are more difficult for us to drill through. These are the very heavily mineralized teeth, which of course is going to be harder to remove all the mineral from during this demineralization process. And other people have much softer teeth, far less mineralized. And for them, it's going to be much easier to start this decay process. So I think that's probably the most important factor. The other very important factor is the saliva, because everybody has saliva in their mouth, and the quality and the quantity of that saliva is really important. If people have got lots and lots of saliva, it will wash sugar away much more readily. And if they have dry mouth, whether genetically or sometimes in response to having different medications, that can sometimes really impinge the defenses that our body has to try and start this demineralization process. The other thing, of course, is the quality of the saliva. Some people will have lots of mineral in the saliva that will fix and repair the teeth. Other people will have lots of those bacteria that we spoke about, the ones that really fuel that process of stripping the mineral from the tooth. So these genetic factors are really, really important and will massively sway and influence whether a patient will have lots of decay experience or less. The reason we do focus mostly on sugar though is because genetics is a difficult thing to modify. Once you have it, you have it. But the reason I always explain this to patients is it helps them to understand that it's not always their fault, and that then allows them to choose the standard that they need to apply. Because if I have a patient who eats sugar but they never get decay in their teeth, then I don't need them to modify their behavior. The time I need people to be careful about what they're putting into their mouth is when they have a problem. And obviously that's going to be much more likely for patients who are genetically susceptible because of the structure of their teeth and because of the salivary composition. But right, let's talk a little bit about sugar then. Because sugar quantity, especially when we're talking about dental decay, is much less important than the frequency within which we take in the sugar. And the reason is that we mentioned this equilibrium. Now what we find is, they've done lots of experiments on this, is that if we eat something sweet, sugary, then the mouth will become acidic for about half an hour. And then the body will have the opportunity to remove the acidity and neutralize the environment so that we go back into that phase where we're remineralizing and repairing the tooth again. Now, imagine if we have a sugary snack, and then about half an hour later we have a little cup of tea with one sugar in it, just one, and then again we pick up a biscuit half an hour later, and then a sweet half an hour after that. Then what we've done is we've allowed our mouth to be in this acidic, demineralizing environment for much longer than half an hour. And this is where that equilibrium will really get tipped over to one side, and we'll be stripping mineral out of the tooth massively. Now this is when the decay process can really take hold, and it will start to really spread through the tooth to the point where we will develop these cavities and holes in the teeth. And that's why it's so much more important when we're talking about the sugar component of what can cause decay, that we convey that to our patients and to you so that you understand that it's the frequency with which you're having sugar that's the real problem, not the amount that you're having. So that's sugar. And then the other thing that we are aware of that we can modify is fluoride. So fluoride is an ingredient that in some parts of the country is added to water, but also is readily available in toothpaste, which contain fluoride, and also some mouth rinses, and also varnish that we as dental professionals sometimes apply to teeth when we believe that they're susceptible. Now what fluoride does is it actually alters the minerals that we spoke about, and without getting too technical, it makes them bind into the tooth much better than the normal mineral does. So if it locks the mineral in better, it's harder for it to be removed when this acidic demineralization process happens. So it's a really handy thing, and something that we will often prescribe a high fluoride toothpaste for a patient where we're seeing that they're experiencing lots of decay. So I hope this helps a little bit to explain that there is more to the story than just sugar, and certainly a lot more to the story than the quantity of the sugar that you're having. So we have to understand that there are certain genetic factors that will, I suppose, set the level of risk that you will have as a patient, and your dentist can definitely give you feedback on that based upon a clinical examination and checking x-rays and the like. And once we establish what your risk profile is like, that's when we start to decide, right, how much of a change do we have to make to this patient's sugar intake, and do we need to add fluoride or take it away? And that for me is a really nice way of looking after a patient and trying to tailor the management of this particular dental disease so that we can protect you against it. I hope you enjoyed that video. And if you liked it, then please do like, subscribe and share. And join me on the Smiling Dentist YouTube channel for more videos just like this.